Welcome back. Most of us are dreaming of summer, so today we thought we'd give you some ideas on how to get summer ready while it's still super cold outside.
Yes, and if you have vein problems, this is the time to take action, so when the warmer weather eventually comes, you're going to be ready. Dr. Dana Gray and Connie Laux join us now from the Milwaukee Vein and Laser Center with how to choose the best practice for your vein treatments. Hi, ladies.
Hello. Good morning.
How are you guys?
Good. Great. Thanks.
Good. I think this time of year is a time that is a great time to consider doing some with your legs because they're constantly covered, but also it's a time that you can come in and make sure if you're having problems that you're getting treated, right?
Oh, absolutely. You know, just like you said, we're covered, so we're not even thinking of our veins at this time of year. And the other reason that we might not be thinking about it is that the symptoms might not be as noticeable because it's colder, and so you know the warmer weather creates vasodilation, and so we'll notice those vessels and the pain a little bit more in the summertime. So now's the time, because as soon as the summertime rolls around, of course it's going to be too late because it takes a while to really get those legs looking good.
So how do you know though if your veins need to be treated?
Well, keep in mind that vein disease is more than just a cosmetic problem in some people. So obviously some have very obvious varicose veins, but if you don't have anything that you can see, you can still have vein disease. And some things to think about or look for are symptoms, which are pain. People can have everything from a dull, aching pain to restless legs, itching, and then as things progress, they can have swelling, skin changes, and even ulcers or skin breakdown that requires treatment sometimes to make it better.
And you've got a great video that kind of displays some normal veins and what they look like first.
So this is an ultrasound, which is the ultimate diagnostic tool for vein disease because it can tell which direction the blood is flowing. And in people who have bad veins, the veins are going to be flowing away from your heart or towards your feet, which is why it causes so many problems.
And here's an abnormal vein.
So you'll notice here, there's a very long swish, and we look at the direction the blood is flowing, and in this particular vein, you'll see a lot of white up on the top of the screen, and I'm not sure if there's audio here, but you can hear a loud swish.
I did hear that.
In an abnormal vein.
Okay, and that just has to do with the blood flow. It's not how it's supposed to be, right?
Correct. Correct. You have valves in your veins, and what happens in vein disease is your valves get bad ultimately, and instead of keeping the blood from flowing backwards, they're open, and so blood flows to your feet.
And that's where you get the pain, the swelling, and the symptoms that you talked about. I know that you can do cosmetic treatment. You have the full service and very comprehensive treatment for that so that people can clear up their legs and legs can look beautiful. But I think people often wonder, then they see that ultrasound so that you know there's a problem. How then do you treat vein problems?
Well, as far as the vein treatment, we have several steps that we start with. And on the medical side of things, like she said, we do a diagnostic test to determine whether or not they need to come in to do maybe the endovenous laser ablation procedure and so on first. But at Milwaukee Vein and Laser, what makes us a little bit different is that because we are full service, we do an ultrasound-guided sclerotherapy procedure as kind of an intermediate step for some of those intermediate branch vessels. So there's multiple sizes of vessels, and so once we get to those tiny, teeny little veins that are on the surface that most people are concerned with cosmetically, that's several steps down the road. And so in between, this ultrasound-guided procedure is something that's very important to really get a thorough treatment, because some people can notice some pain from even those veins that require that intermediate treatment. So we have a video of that as well, and I'd like Dr. Gray to explain what's being done in this procedure as well, because that's something that these radiologists and interventional radiologists that we have at our clinic are real specialized in.
So here you see a black hole, and that's the vein, and the needle, the little bright area, is going into that vein. And in a second, you're going to see an increase in the amount of white in that vein, which is the medicine that we're putting in, and this is called sclerosant. And what that does, when it enters the vein, it irritates the wall and closes it down, similar to a laser, but instead of using heat, we're using a chemical treatment.
Okay, and then what does that do? So it stops the vein and it stops the problem? You don't have to have that vein removed, or what happens to it?
It essentially closes the vein down.
Okay.
And so no, those veins don't have to be removed. We do also a third treatment, which is vein removal through tiny little needle holes that don't even require a stitch, but that's one of the 3 treatments that we primarily use. Most people need more
And vein treatment has come so far from being something where people the only option was stripping, which sounded painful, and there was a lot of downtime, to this where you can do it in your office, local anesthetic, pinpricks, as you mentioned. And I often wonder, when you look at treatment for something like this, do you look at price? Do you look at quality of service, or how can you find both, the best price as well as the best quality?
Well, most insurance companies do cover these procedures, and we are in network with many of them. So, you know, honestly, the price in the area is pretty competitive. So really what it comes down to is that patients should just be their own best advocate and look for the best comprehensive services available. And like I said, you know, there's a lot of really great clinics in our area, but some may be better than another for the reason that they're going to have all of those services available under one roof. So our team of doctors are interventional radiologists and radiologists, and so they're very specialized at reading these tiny little veins in these images that you see. And so, you know, maybe looking for something like that would be part of the decision-making process.
Yeah, and you guys have a free screening that's coming up in an open house, so people can come in and do that screening for free.
Yep. Yep.
And that's happening on Tuesday, February 11th. Again, it's a free screening ultrasound to find out if you have veins that are a problem and need to be treated. And you can find out more about the Milwaukee Vein and Laser Center. They're located on West Layton Avenue in Greenfield. The phone number is 414-761-VEIN or 8346, MilwaukeeVeinandLaser.com. And you brought some beautiful compression options where it's not even going to be obvious for athletes. These are just go over the calf.
Right. I mean, I have some compression on right now, so there's
you
just
would never
so
know.
many different
And
options.
these are nice and warm looking for winter in their compression stockings.
These are made out of wool, and then these are something that we just recently approved for post-treatment that they can just wear over the calves.
Fantastic.
So, I mean, the reason that I brought these is just to show people that there's so many different options. Compression really isn't the downfall of having these treatments anymore, because they're comfortable, and who would want to have that extra layer this time of year anyway?
Like
so
exactly, that's great. Thanks,
all right,
you
mention
guys.
the morning blend, and you can get the free compression stockings as well with your treatment. So thanks so much, ladies.
Nice to have you.
Thank you.